thanks, Leonor. Was excellent. Well done. Thank you. And you know, you're right. There is no perfect time. You can relax now. But there is no perfect time to talk. But talking is hugely important. And the other bit is, you know, the Irish psyche at times is we kind of don't want to talk about the stuff that's bothering us in case that we bother other people. But it's good to talk. Leonor is right. There is no perfect time. There are no perfect words. Just do it. Talk about it. Be honest and open about it. But talk when the time is right for you. And that's the important bit. Picking the time that's right for you and doing that. One of the important things, of course, is as we consider what we're going to say and how we're going to say it, is probably just to be more conscious of ourselves and what's going on in our own minds. And I suppose that leads us very neatly on to our next speaker, which is Norah Twomey, and she's going to talk about mindfulness and living well. Norah is a qualified mental health nurse and general nurse. She currently works with within the mental health setting as a community mental health nurse. She also teaches mindfulness-based stress reduction to clients within the mental health setting who suffer from depression and anxiety. And she's also a yoga instructor and teaches yoga privately. So we're delighted to have Norah today, so I'd like to call on Norah to come up and present to us. So, Norah, you're very welcome. I'm going to get your presentation for you there now.
Good morning, everybody. Thank you for the last two speakers. It was most interesting and informative. I'm going to talk about mindfulness in the context of the course that I run, which is mindfulness-based stress reduction. I'm not the best at technology, so I may need a little bit of assistance as the talk progresses. However, I will do my best.
This one.
Okay, yeah. Thank you. Right, okay. So as Brian said, I work within the mental health setting, so you might wonder, what am I doing here talking to you about cancer if my background is in psychiatry? And I guess the answer to that would be, it's mindfulness-based stress reduction. And what can be more stress-inducing than a diagnosis of cancer? So when we talk about mindfulness is, I'll do a definition first of mindfulness. Yes, it works. So what is it? So it's a moment-to-moment awareness. So it's awareness of the present moment, of actually here and now. It's paying attention on purpose to the present reality and the clear single-minded awareness of what actually happens to us or within us. So knowing exactly how we feel, knowing exactly what's happening inside us and around us. And it's awareness with acceptance, as opposed to not wanting. And we'll talk a little bit more about that as the talk progresses. So I'm sure a lot of you know more about mindfulness because it's in the papers, it's in the radio. It seems to be the new buzzword at the moment, mindfulness. So it's based on an Eastern tradition, but it's not dependent on any belief or ideology. So it doesn't matter what religious background you come from, you can practice mindfulness. In fact, the Catholic Church has really embraced it over the last years. It's a contrast to states of mind in which attention is focused elsewhere. And what I mean by that is on the past, on the future, worries, plans, and behaving automatically. So it's the opposite to that. It includes a sense of approaching all experiences, so the good, the bad and the ugly, the pleasant, the unpleasant experiences, with openness and with a kind curiosity, rather than avoiding experience and painful emotion. And John Kabat-Zinn is a medical, he's actually a microbiologist. He was the gentleman that brought mindfulness into the medical field in the late 70s in the US. And he set up this it's an 8-week course, and I'll talk a little bit more about that later. And mindfulness has been practiced in the East for thousands of years, but it's come to the West only really in the last, in the 70s, I guess, and for medical care particularly. Again, mindfulness, it's intentionally directing one's attention. So you are purposely paying attention. It doesn't come easy because the mind tends to wander. You will know that if you sat for a few moments and just focused on the breath, and if you tried even after a minute or two, you will know that your mind has wandered, because your mind has gone off into thinking about, what am I having for dinner tonight, or can't really hear what she's saying, or this is boring, or what am I going to say to my teenage son later. This is what the mind does. So you have intentionally directing attention without judgment, without internal dialogue or self-talk, emotional reactivity, physical reaction, or attempting to avoid the experience. Mindfulness meditation, it's not positive thinking. Some people think it's positive thinking or avoiding thoughts or not thinking. It's not this. It's not a relaxation technique, but some people find that they can go into a relaxed state from the mindfulness, but that is not the purpose of mindfulness. It's not going into a trance. Like somebody said to me during the week, when I was meditating, I just went into a trance and this state of this blackness. It's not that. And it's certainly not an attempt to stop thoughts and thinking. Or it's not a distraction technique. If we're looking for distraction techniques, we can do a bungee jump or go to the local spa. So it's not any of those things. Our judgment and our thinking is often derailed, and a lot of our emotional pain comes from unexamined emotions. This automatic tendency to feel or react a certain way, and these have been ingrained in us over many, many years. So when we don't examine our emotions and when we act automatically, which we all tend to do, then our judgment is easily derailed, and we end up with a lot of emotional pain and distress. Failure of curiosity. If we can stand back sometimes and actually observe ourselves, our mental states, our emotional states, we'd be quite surprised at what we find. Over concreteness or rigid thinking. You know, I thought like that when I was 15. I still think like this at 45. I've never actually stepped back and looked at a different way of thinking. And often our pain as well, inability to reframe an encounter. So some people, as Maureen said earlier, we can actually, I'm not going to let this cancer, I'm trying to think of the words you used, but basically you said that it's part of me, it's not all of me, were your words. So the cancer is not all, and obviously it's been a huge journey for you, and I'm sure for all of you here. So mindfulness again is being with an unfolding experience, what's happening here and now, whether that's sadness, whether that's shock, whether that's anger, whether that's disbelief, whether that's depression. It's being with this without adding our usual elaborations and distortions. So it's sitting with what is here right now. It's not avoiding or distracting from the pain. So I suppose, again, mindfulness-based stress reduction, again, John Kabat-Zinn. Thich Nhat Hanh, I know some of you would have heard of Thich Nhat Hanh. He's a gentleman from the East, I'm trying to think of Vietnam, I think it is. He's a Buddhist monk, and he was in Ireland about 2 years ago. I don't know if any of you are aware of this man. He was in Killarney running a retreat. But he says meditation is not escape from life, but preparation for really living in life. And John Kabat-Zinn talks about the full catastrophe of living. So the pain and the angst, the sadness, the joy, we marry them all when we're mindful. As I said earlier, there's a lot of talk in the media, and it's very much controversial now, mindfulness. So the course that I run, which is based on John Kabat-Zinn's course, it's an 8-week course, and I run it on a Wednesday night, and as Brian said, I run it in the mental health service, and it includes a sitting meditation. It includes a body scan. Some of you might be aware of a body scan already. Breathing exercises, mindful hatha yoga, walking meditation, and informal daily practices. So the informal daily practices would be getting up in the morning, and when you go and have your shower, that you're actually in the shower, that nobody else is in the shower with you in your head. So your boss is not in the shower with you. You're with yourself in the shower. You're brushing your teeth, and you're mindful of of brushing your teeth, and mindful of eating your breakfast, even eating mindfully. There would be examples of informal daily practices. The other activities taught are didactic and experience education about stress and mind-body interconnections. We use poems and metaphors. As I said, we do the informal practices, and all the sessions are concluded with a discussion of the present experience, how people are feeling right now. So if people are upset or if people are angry, all of that is welcomed and acknowledged. And then there's practice every week, and I suppose the crux of the 8 weeks is the home practice. Because I can stand here and talk to you for half an hour on mindfulness, but really you're not going to have any grasp or concept of it, because mindfulness is not about the head. Mindfulness is essentially experiential. We practice mindfulness. That's what it's about. So the primary goal is to establish the habit of mindfulness. So no attempt is made to change what a person thinks or experiences during the practice. So that is really, really important. So pain and anger and anguish and shock and disbelief, all of that is welcome and acknowledged and noticed and observed. So R.D. Laing said, the range of what we think and do is limited by what we fail to notice. And because we fail to notice, there is little we can do to change until we notice how failing to notice shapes our thoughts and deeds. So what can one be mindful of? So we can be mindful of our body. We can be mindful of physical sensations in the body. We can be mindful of our senses, our hearing, tasting our food. How many of us eat our food watching TV? How many of us eat our food without actually tasting our food? We can be mindful of our perceptions, of our thoughts, of our intuitions. We can be mindful of our cognitions, our judgments, and our emotions and reactions, and generally our states of mind. That's what we teach in the mindfulness course. So, as I said earlier, mindfulness is experiential. Essentially, we practice mindfulness. And as John Kabat-Zinn says, meditation is best described as a way of being, and what's most important about it, it's like weaving a parachute. You don't want to start weaving the parachute when you're about to jump out of the plane. You want to have been weaving the parachute morning, noon and night, day in and day out. And then, when you need it, it might actually hold you. The way we practice meditation is to do it every day, to carve out some time every day that's just your time for being. So mindfulness and meditation is about being versus doing. It's about sitting with the here and now, as opposed to going back in the past or jumping ahead to the future. Now, various studies in cancer care indicate that the practice of mindfulness improves sleep, enhances the psychological flexibility. We can think differently about our day. We can't actually change what is, but our point of view may change, even though the situation doesn't change. A release of attachment, understanding of impermanence. And I guess if somebody gets a diagnosis of cancer, it's like shock, horror, disbelief, I've lost control, that sense of permanence, maybe that sense of losing your life. All of this must come into play. So with mindfulness, we can begin to release that sense of attachment or wanting things to control things, because essentially none of us have control over diagnosis that we are given. It reduces levels of cortisol, it increases the resilience in the human being, it increases a sense of meaning and purpose. And here, one aspect of life and no longer the predominant story, as Maureen said earlier. Now, it's demonstrated its usefulness in treating chronic pain, psoriasis, anxiety, panic disorder. I've written here prostate and breast cancer, depression. The clinical research demonstrates long-lasting improvements, improved health-related quality of life, reduced chronic pain and physical distress, fewer and less intense headaches, reduced pain-related drug use, decreases blood pressure, and this was another finding that they found in cancer care. It reduces hypertension, strengthens the immunity, again, which is really important for people with cancer, improves sleep quality, reduce tension, anger, and fatigue. And again, tension, anger, and fatigue would be very common to people with diagnosis of cancer. Again, the research demonstrates long-lasting improvements, improve regulation of emotions. So I can imagine when you get a diagnosis of cancer where your emotions are all over the place. And as we know, some emotions have a much higher charge than other emotions. We can hear something and we'll be a little bit upset about it, but something like a diagnosis of cancer must just blow your emotions out of the water. It increases social activity and vitality, reduces anxiety, panic and depression, reduces substance abuse, decrease interpersonal problems, increased sense of meaning in life. And again, that's another one, when they were looking at research for cancer, it increases sense of meaning in life, enhances self-esteem, decreased psychiatric hospitalizations. So how does it do this? What are the underlying mechanisms involved in mindfulness? Now, research shows that changing deeply ingrained habits requires developing awareness and discontinuing old behaviors, establishing and repeating new behaviors. Now, this occurs over a significant period of time. So with mindfulness, there's no quick fix. So some people come to the course, and even though I spend about 45 minutes with each person before they come in and do the course and explain what it is, there is nearly always one or two people that will drop out because they've read all the literature, they've gone on YouTube and watched John Kabat-Zinn do his talk, but it's completely different, actually, the practice of mindfulness. So you're sitting down and you're actually focusing on the breath and you're observing your mind states, your emotional states, and it's not easy to do because our mind automatically goes to thoughts. So, and it's over a period of time, and I suppose the best analogy I can use here, if you want to learn to play the piano, it doesn't matter how many concerts you go to, it doesn't matter how many books you read on music and how many books you read on piano playing, you're not going to learn to play the piano unless you sit down and practice, unless you sit down and make all the mistakes. That's how you learn. So the very same with mindfulness, it is experiential, it is practice. Now the habits, these habits can be either ways of thinking. We think a certain way, we've been like that. We're I suppose, hardwired to think a certain way, and it depends on our family and our ability to connect with other people, and what we've been brought up with, and our culture is very, very important. So we don't really question, or we don't observe often our ways of thinking, our ways of speaking, our ways of behaving, but mindfulness actually shows us how to do that. So also there is some research, a lot of research for depression and anxiety, but more research is warranted into the efficacy of mindfulness for people with cancer. But existing research and anecdotal evidence lead us to summarize that this intervention has potential benefits for those suffering from a serious illness. It is recommended that this intervention be applied as close to time of diagnosis as possible, and that's self-explanatory. Now I'm just just got one testimonial here. It's from a lady that attended the course. It's with grateful thanks to mindfulness, a life-changing journey through meditation and stillness, that I have become peaceful and healthy. I have begun to accept the past, thereby releasing an inner anger that had stolen all joy from my life. And coming from wonderful counselling over many years, it was the practice of mindfulness that finally released the inner pain and turmoil. And this other lady, I was never content to accept the status quo of a solely medicated recovery. This opportunity to learn mindfulness through meditation handed me back control over my illness and my own well-being. It is now my decision on a daily basis how well I want to be. This life skill has empowered me at a time when I thought I was only at the mercy of external factors. It's mine, I own it, and it has improved my quality of life in every area. It's the difference between feeling empowered and feeling a victim. So, we're going to do a little practice of mindfulness. So I'm going to ask if you would find a comfortable way of sitting. So, if you would like to, your lower back needs to be against the back of the chair, if that's possible for you and if that's comfortable for you. And the upper back may be self-supporting. So the upper back needs to be away from the chair again, if that is comfortable for you. Your hands on your lap, you can have your hands facing down, or you can have your hands facing up to the ceiling. And now just closing the eyes. So, sitting here and becoming aware of where your mind is right now. What am I thinking about? Just knowing what you're thinking about, having an awareness. That's all. You're keeping that distant. You're not going into the story. You're just naming what you're thinking about. And allowing that to go and bringing your attention to your breath. So noticing your breath. So you may notice the breath coming in through the nostrils. You may notice the breath going out through the nostrils, warmer air. You might find that you can connect with the breath in the chest or in the belly. So you may feel the breath coming in through the belly and rising, the belly rising as you inhale. Or you may be aware of the belly falling away as you exhale. So we're staying with one inhalation. Notice the space between the inhalation and the exhalation. Notice if your mind has gone off into a little story or a judgment or a plan. And if so, that's quite okay. That's what the mind does. Just very gently guide it back to the breath. So the breath in the nostrils, the exhalation in the belly. So one inhalation, just this inhalation. And exhalation, just this out breath. Perhaps you can notice the shoulders lifting gently as you inhale. Or the body relaxing more as you exhale. bringing attention now to the physical body. So just notice the buttocks on the chair. Noticing your feet on the ground. Having an awareness of your feet touching the ground. The clothing on your legs. Noticing the connect between the material and your skin. Noticing the socks around your ankles. Noticing the air bathing the exposed parts of the skin, whether that's on your hands, or your arms, or perhaps just around your neck and your face. Paying fine attention, being curious, just observing what you're noticing. Check in with the mind. Has it wandered off into a thought about something or other? Maybe something completely unrelated to what we're doing right now. If so, bring it back to the body. So we're looking at physical sensations in the body. How are we feeling in the body right now? Do you notice a tightness or a tension in any part of the body? So we're observing. We don't need to make a judgment. And if we are judging, we just notice that we're judging. If we are thinking, if we're lost in thought, come back to what you're doing with the body. And by doing that, you're practicing mindfulness. Coming back each time. So no matter how many times the mind wanders, we can come back. Because we're purposely paying attention to the here and now. Which is the opposite to lost in thought. Coming back to the body. We might even find that we're quite sleepy and tired. Or exhausted. So can we sit with that without a commentary or a judgment from the mind? Just notice how we're feeling in the body. We might feel tense and tight. There may be some discomfort in a part of the body. Can we sit with that discomfort? Or we might find that our body is quite at ease and rested. So we don't necessarily have to celebrate that now, we're just noticing what's here. So I'm going to invite you now, we're just leaving the body and coming back to the whole body and coming back to the breath. So once again, just guide your attention to your breathing. So this is a new breath, an opportunity for a new beginning. And as you exhale, it's an opportunity for letting go. So can we notice that very small space between the in-breath and the out-breath? So you're pinpointing your attention. You're focusing your attention. Again, noticing the mind state. If the mind has gone off into thought, just notice that. And gently, as you would a little child that's run off, you would gently hold its hand and bring it back. So now you can very gently come back to the breath. So sitting here for a moment with your breath until I ring the bell. Just observing what's presenting. Might be thoughts, emotions, Or we might be able to stay with the breath. You will see from that 5 minutes practice that the mind would have wandered maybe hundreds or thousands of times. Whose mind didn't wander? So that's what the mind does. So it's as I said earlier, it's experiential. It's something we practice. Reading the books and listening to CDs and watching YouTube videos and listening to me doesn't give you the skill or teach you mindfulness. It's all about the practice. So thank you very much for listening.